Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, July 24th, and it's nice to be back for another one of our weekly chats. I'm here again, of course, with Edward Brubaker, Living Branches President and CEO. Howdy.
Good afternoon, and you weren't here with us last week. You were on a well-deserved vacation, so how was Ohio Pile?
Well, Ohio Pile, first thing to know about Ohio Pile is, despite the name, it is not in Ohio. It is in southwestern Pennsylvania.
Kind of like Indiana University is in Indiana, or is not in Indiana, it's in Pennsylvania, right?
Exactly. It was wonderful. It's gorgeous. I'd never been out there before. We went whitewater rafting, we went hiking, and I had almost no cell service, so I did not check my email at all. Which was wonderful during the time, and now it is problematic. So if you emailed me last week and I haven't gotten back to you, I certainly apologize. I'm working my way through, and you can email me if you need something immediately. But I had forgotten how nice it is to relax. So I hope you will be able to go on vacation sometime soon.
Hopefully at some point, but risk management, I assume they signed off on your whitewater rafting.
Luckily, I was not the one who fell out of the boat. That would have been Dominic.
Right. Yeah.
But it was really enjoyable.
That's great. Good. Well, welcome back.
Thanks. Good news while I was gone, in that in Living Branches, as we talk about COVID cases, we really now have only one person who's continuing to test positive for COVID, and that is at Souderton Mennonite Homes. That is a resident in our memory care Parkview there. Everywhere else, there are no other positive cases, so we're very grateful for that. And I hope that lasts for a long time, but we of course are working very hard on the assumption that it won't, and we still need to remain diligent. Right. So while I was out, we had a fairly significant number of questions coming in from residents. So I've got 3 of them for us to address today. Our first one is, we've had a couple of questions regarding information that people have seen on the news, et cetera, about support coming for the federal government for nursing homes and retirement communities. Could you talk a little bit about what support is coming?
Yeah, and there's a lot of different areas in that regard. Probably the most recent thing that came out, and that was discussed a little bit last week when I was on with our medical director, Dr. Hamowitz. But we're supposed to be getting these point of service test kits, testing equipment. And so we have not gotten ours yet, and certainly we'll update on these videos when we do. But they're sending that out to the nursing homes across the U.S. There's 2 different companies, and we did find out through our own research that one is more accurate than the other. So certainly we're hoping for the higher accuracy one to be shipped to our locations. We understood there may have been some facilities in the area, not close in the area, but some that have already gotten them, but we have not yet. But we want to implement that as part of our overall testing strategy that we are still working on. We're not required to do regular testing other than the baseline testing, which we've done, but we want to look at that, because I really do believe that kind of ongoing, some type of serial testing will be important for us to do. It also could be a way that we screen visitors too. And so anyway, more to come on that, but that is kind of the most recent thing that people were probably reading about in the media. We've also gotten monies from HHS, some money from the state too, and those are to be used for either reduced income because of lowered occupancy or increased expenses because of PPE supplies and that kind of thing. So we have to prove that we had those expenditures of that lost income. But we did get, I would say, a significant amount of money from the federal government and some coming through the state government as well for that. So that's one of the things that is happening. So there's direct money coming in, but then there's also some equipment that they're looking to send as well. We also, along the way, got some PPE equipment from FEMA. The downside is some of that stuff appeared to be in storage for a period of time till it got to us from other disasters or whatever. But every little bit helps, and we have been getting things along the way. But the largest has been actual dollars, and then the upcoming testing equipment that we anticipate receiving.
I was pleased to hear that when we talk about the difference in accuracy between the testing brands, that I think we were saying one was 95% accurate and the other one was 85% accurate, which was actually encouraging because initially we had heard that some of those that testing equipment that was more rapid was not accurate at all.
Yeah, and without disparaging brands, because it's all part of the process of going forward, Abbott was the one that was not as accurate. The other two were, I think, BD and Quadel or something like that. I forget the name exactly, but those are the two that the feds are now looking at. So, yes, it is increasing. There's also other test strips that are being checked. That is not something that we're going to be getting, and it's not accurate enough at this point in time. But I think there will continue to be more options and opportunities for us in the future.
And maybe just a point of clarity that while the government talks about, hey, we're sending this out to nursing homes, in our situation, there certainly would be no requirement that we could only use those in the skilled nursing portions of our communities.
Yeah, we're not understanding that. And frankly, I think are supposed to get some of the cassettes and the actual equipment that is a one use for each test. So in the future, we'll have to buy that, those test kits and that kind of thing. So the reagents, the test kits, all those kinds of things, that's an ongoing test, or an ongoing cost, I should say, for the tests. And so we'll need to buy that in the future. And frankly, that's sometimes the things that are in short supply too. So it's always this kind of balance with the supply and demand that becomes more challenging.
Okay, great. Mm-hmm. I had two questions from residential living residents this week, asking for clarity about what they can do when they're off campus. So maybe you'd like to address that.
Well, they can't do anything that I wouldn't do.
Well, that's a broad parameter.
Yeah, right, exactly. That's pretty wide open. Yeah, that's an interesting question because certainly in residential living, while we had some restrictions, of course, for visitors coming onto the campus, and had some restrictions as to, I would say, more suggestions. I mean, if persons snuck off campus, we didn't have guard houses at the gates, which I would say there were some communities that do have guard houses, and persons were not allowed to leave the campus. So there's all kinds of different ways in which different communities were doing it. And so residential living in some ways has been this area of here's some recommendations or here's some restrictions to visitors. So we put those out there, but residential living, these persons are very independent, many of them as independent as you and I, and so they have their lives to lead. As well. And so other than what I would say those lighter restrictions that frankly many people in the wider community were abiding by as well, we never got into the same level of closing down, if you will, particularly in cottages and villas because of the various entrances. Having said that, we still wanted to make recommendations and just good practices for people. And so I would say that's what it is now. So in the past, we said, well, you need to eat, so you need to go to the grocery store. And so those trips, you need to figure out how to do them safely and certainly mask and wash your hands and don't touch your face and all those kinds of things. And keep those trips to a minimum. Don't go to the store every day, those kinds of things. Consolidate your trips. So many of the things we were doing were recommendations. And so that continues to be where we're at too, and saying, here are the things if there's things you can't do, we'll certainly be clear about that. But other things, you just need to be smart. And so I recognize that some people would like to have the list of the do's and don'ts, and other people would say, don't give me that. I don't want that level of restriction. But it's really just finding those best practices, those best behaviors to keep yourself safe. Another way to think about it too is if I'm interacting with you out in the community, now hopefully we're both masked, but a few months ago we weren't.
Yep.
Whenever I'm interacting with someone, when I don't know where they've been, I just interacted with everyone they've interacted with in the recent past. That's really the issue. When we don't know someone and where they were and who they were interacting with, we don't know how many persons we're effectively interacting with when we're interacting with them. And so those kinds of thought processes to think about, oh, okay, what does this mean if my grandchild comes to see me who, may have interacted with this friend or that, or maybe had gone to a service at their church. And so those are the kind of things to keep in mind, and just do those safe practices and recognize that if you then interact with that person, who you interact with is also interacting with that person and all the persons they interacted with. So it's those kinds of things to keep in mind to try to keep safe.
And maybe we should just clarify for our residential living residents and their families that we are happy to be a resource. So
Absolutely,
if you've got questions or thoughts about, hey, should I be doing this, contact your social worker, and they will be happy to be a sounding board.
Yeah, and the idea here is let's do those safe things. And through conversation and reading, and recognizing too that probably different people are going to have different levels of what they feel is safe. But within the big picture parameters, there's still some things that we would say, okay, these are things that still will not happen on our campuses. Yeah.
Including visitation from persons who are coming from any of the states that have been quarantined.
Correct. And I will have to say, I mean, you and I were just talking about this earlier. Our daughter was planning to get married in Glen Mills, or I think it's Glen Mills down at Terrain, but that was supposed to be the end of August. That was then canceled till next year. Well, then they wanted to get married in Missouri, where her fiance is from, and have some of his family, just a very small group. And we talked about, well, if Missouri's added to the quarantine states, that could be a problem. And just today, I got an email from HR, and Missouri and Wyoming were added. Now, states could be deleted too, but it impacts all of us. It impacts all of us as to those kinds of things. And so we all are making changes, kind of shifting and making last minute changes. And that's kind of the reality of life right now, unfortunately.
Yeah, it really is. So, other question that I had from a family member, this was a family member in personal care, who was calling to say she had heard a rumor, and I think she even used the word rumor, that she was going to be unable to see her mom, who lives in personal care, in person until probably next year. And she was calling to say, we can't do that. And so maybe we could share with some people what our plans are regarding that type of thing.
Yeah, and I would say, unless the entire system collapses in the next couple of weeks, that would not be the case, what you just stated. And that would be almost impossible to really have that happen in reality, because we do need to have those connections. But we do have a task group that's a subcommittee or a sub-task group of the coronavirus response team that's working on easing of restrictions. And particularly the focus is healthcare and personal care, because as we just talked about, residential living is a little different category. But within the larger buildings, the places where there might be semi-private or two-person rooms, areas that we are much more interactive with the resident and giving their care and providing food, et cetera. Those are the areas we're focusing on. And so we're working at what are the ways in which we can safely ease some of the restrictions. And that's literally, a week or two out until we are looking at, I think, early August to roll out some of those new processes and guidelines. So assuming things to continue in Pennsylvania as they are now, that's our goal, and that's what we want to be looking at. But a specific answer to the question of not seeing mom face-to-face till next year, like I said, unless the whole world collapses in the next 2 weeks, that is not certainly part of the plan. that we do want to provide opportunities for the easing of restrictions, for ways in which visitation can take place safely. But again, at the end of the day, we have some level of responsibility to do this well, not only ethically and otherwise, but we have state regulatory agencies that we need to be paying attention to as well.
I received a letter from residential living residents who have family members, spouses who are in higher levels of care, and just talking about how incredibly difficult this is.
Yeah.
And there have been so many ramifications and different facets of this for different people. But I guess just to let people know that reuniting people safely and quickly is really almost the number one priority that subgroup is working on.
Oh, absolutely. And the emotional toll is, I don't think it's fair to measure it against the physical toll, because we don't, how do you really compare and contrast, because they're so different, physical and emotional, but they're both important. Mm-hmm. And frankly, when you go into restrictions, that tends to be more focused on keeping people physically safe. And the emotional toll of this disease has been devastating as well. And I'm reading more and more articles about that, but I hear it from families too that may email me or call me or see me in the community and really talk about that. And it is serious too. And we really need to pay attention to that while still working to keep the virus out, because that's a problem as well, because we don't want to go backwards either. So yeah, it's a very challenging time, and the emotional toll on people is very heartbreaking at times. Yeah, very,
it is.
Very much so.
Well, yes, but hopefully end of next week, beginning of the week after, we will be able to make announcements about what our plans will be for reopening back up in healthcare, memory care, and also in personal care.
Yeah, and maybe just another word on that too is, you might say, well, gee, why didn't we have that ready? Well, we didn't get things from the state that then we have to put in place from what they got to us. And that's not to blame them, but just we're all learning together, and it takes time, and it's unfortunate the length of time that it does take, but there's a lot of details to work through, a lot of details.
Yeah.
And so, unless you're directly involved, you don't really understand the complexity of it. But suffice it to say, we are working as quickly as we can to really roll it out as safely as we can.
The form alone that came from the government that has to be filled out in order to get your plan ready to operate was not short.
Yeah, exactly. Yeah. Exactly.
So there's a lot to do.
Yeah.
So, those are my questions for this week. Did you have any further comments that you would like to make, or shall we wrap up and let people get on to their lives early this week?
Well, we could wrap it up too, but I'll just reflect again. Last week we had talked a bit, and this week too, about testing and the test kits that the state is coming up with. I have asked a person, one of our projects person in Living Branches too, to work at some testing strategies too for us, and looking at what are our options for the future. Again, this is not things that we're required to do by the state, but I really do believe that some level of testing on a periodic basis will be important for us to do. And so we're trying to figure out how that fits in, frankly, what the cost is going to be, and how do you measure the cost benefit. But again, all these things that we're doing are with the idea in mind that we want to find ways to ease restrictions while keeping people safe, and using the different methodologies that we can to make that happen, because it really is about helping people connect again. And, that's just been so hard. I mean, I know someone contacted me recently about just, how much am I out and about with residents and staff? And that's been one of the most challenging things for me, because I would say in most other crises that I've had to deal with as CEO, you can be out there eyeball to eyeball with people, interacting with them, being a presence. And so with this, physical distancing and masking and COVID and, hot zones, and it's really been hard. And that's really, for me, been a challenge as well, because it's how do you find that balance? So certainly videos and trying to connect in that way. We do these videos. We've done a bunch of videos thanking staff and connecting with staff. But that's a hard thing, because there's a risk if I'm interacting eyeball to eyeball, face to face, that there's a transmission of disease that can happen too. And so that's the reality between families too. So we really want to find ways that we can work at that. So I would say almost everything we do is focused on how do we safely ease restrictions, and what are the tools in our toolkit that we can use to do that, because it's just so important that people start being able to reconnect in some way.
Well, and when we look at the outbreak that we had in Dock Terrace, our skilled nursing area at Dock Woods, at the beginning of this crisis, and then we look at the outbreak that we just had at the Willows, personal care, totally different setup, and much later, but still, that was over relatively quickly.
Right.
And I think that part of that does come down to better testing availability and strategies that really helped us get a hold of that.
Yeah, and we knew kind of what to do right away. We said, let's segregate. Now, the flip side is there were other things that were happening then at the Willows more recently, and also early on in Dock Terrace that were different. I mean, Dock Terrace didn't have an empty wing that we could take people to. The Willows did, or almost. We could do some reshuffling. And so they're private rooms in personal care. They're not primarily in healthcare. Was there a kind of a super spreader type event happening at Dock Terrace? So there were so many different things that we don't fully know, but you're absolutely correct. We felt more confident in being able to deal with it. And so here's what we're going to do. Boom, let's, jump into action and make it happen. So there's no question we feel more confident now than we did just a few short months ago.
And, on the coronavirus team, I'm usually the person pushing to say, let's open. Of course, part of that is I don't have operational responsibility. But as we continually strive to balance, perfect accessibility versus perfect safety, if you will, I was encouraged, from my perspective, to see that maybe this will help us to be more confident in our ability to maybe err a little bit more on the side of openness, if we can feel that we can handle an outbreak in a way differently. I think if it was April again, all of us would be saying no visitors, no nothing, because we can't risk that. But this may give us a little bit more confidence.
Yeah, that's right. And I know you and I both had received some correspondence recently from a resident who their spouse was in healthcare, and they were reflecting on some things that they'd like to see changed, and how hard it was on them and their spouse, and very understandably so. It was also interesting, though, for her to reflect that she was glad that we didn't have some of the deeper restrictions that she observed at other retirement communities. And I know for us, when you're in the thick of it, it's hard to remember that. But it was really interesting to see that she had a perspective that we had not gone into complete and utter lockdown like some people had, and she appreciated that. But in residential living, we were still able to keep the virus at bay. So it's a balance.
On all things, yep. Well, thank you. Thank you all. Just a reminder for next week, if you have more questions, please feel free. You can email them to me at coronavirusquestions@livingbranches.org. You can call our coronavirus hotline, or of course, if you're on campus, you can talk to a social worker in your level of care. But thank you very much, and have a good afternoon.